Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we talk once a week about all types of globally relevant infectious diseases. I am Joe Schmidt, and with me is Dr. Melvin Senekas. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, everyone. Good afternoon, good evening, depending on where you are at the moment.
With us today is a special guest, and I welcome Rapin Tene. She's the Director of Vaccines Global Pharmacovigilance with Sanofi Pasteur in Lyon. She's also a lecturer at the Siena University and a former WHO consultant. Rapi, welcome to our meeting. It's an honor for us to have you here today.
Thank you, Joe. Thank you, Melvin. Thank you for the invitation and the opportunity to share this platform with you today. And hello to everyone.
So the reason Rapi is here is our topic 3, adverse events following vaccination. Before we get there, we start with our COVID-19 update. Actually, this is COVID-19 update and the monkeypox update. Melvin, what's news with COVID?
Yes, so like what we do every week, we start with a quick global COVID-19 epidemiology update. And we get this from the WHO COVID situation report. And this is not real time. This is a week late. As you can see here, globally, the number of cases decreased by around 9% during the week as compared to the previous week, with over 6.5 million new cases. And the number of new weekly deaths remained stable this week as compared to the previous week, with over 14,000 deaths. And since a week, 6 weeks ago or 7 weeks ago, we have been saying, let's see if the number of deaths go up too, right? And as you can see, it hasn't. So what is this telling us? I think what this is telling us is that because billions of people have some form of immunity now against SARS-CoV-2, whether from one of the safe and highly effective vaccines or from getting COVID itself, it's showing up. And the steady buildup of immunity over the past 2 years is keeping deaths really down as infections go up.
Very interesting, Melvin. I got COVID, my wife got COVID, and we're not in the statistics here because we were tested, but it's not in here, it's not reported. So is this the correct data? Can we trust this?
Maybe it was actually reported by the German government, right? I mean, I don't know. It should be there. You should be there.
Anyway, let's go to monkeypox. How do you explain the almost exponential growth here?
So now more than 80 countries where monkeypox is not endemic or have not been reported in the past, they have also reported monkeypox in this current global outbreak. And confirmed cases have crossed 27,800 so far. And we will be seeing more cases as almost everyone with a connection to the internet or access to mainstream media, TV, radio, or newspaper is now aware of what monkeypox is. Tests are now more readily available, especially in many of the countries that have reported monkeypox outside Central and West Africa. And doctors and people are more aware of it. So we will be seeing more monkeypox cases.
Yeah,
for sure.
Actually, there was a recent WHO meeting, and the lesson I learned from that is, number one, there isn't enough vaccine for everybody in a risk group. And number two, efficacies or effectiveness studies are still underway or planned. It is a little bit difficult to show, but I guess this is what we're waiting for. There is a vaccine out there. There is biological evidence that it's working by immune reactions, but again, effectiveness against monkeypox has not been shown yet. Yeah. Interesting, we come back to that next week, Melvin, right?
Yep.
And that brings us to our special topic today, adverse events. And the other term you need to remember is side effects, SE. And here is the difference. Anything that happens after vaccination and you don't like it is called adverse event. And that can be related, unrelated, or unknown in relation to vaccine administration. So if Melvin gives me my 5th shot of a COVID vaccine and my arm is swelling like this is a side effect. I mean, what else can it be, right? It was the vaccine. Now, if Melvin vaccinates me, I step out of his office, I run into a car, and I'm dead. This is an adverse event, and the relation to vaccination is unknown. And the reason is quite simple. It may well be that the vaccine causes fainting. So I step out of the office, I faint, I drop on the street, a car hits me, runs over me, I'm dead. Anything that happens after vaccination that is of some seriousness should be reported as adverse event. And what you need to do is you need to do a causality assessment. Side effect means the causality has been shown. If you know causally this intervention causes a certain effect, then this is a side effect. And again, you need causality assessment to make sure that an adverse event is a side effect. Now, what is the problem? The problem is the so-called beta error. You want to show that my death after COVID vaccination was due to the vaccine. So you have to do a study with, let's say, 20,000 subjects, and you won't find that people die because the event may be 1 in 100,000. So you do a study with 1 million subjects, and then you may not find that there is a causal relation because the effect may be 1 in 1 million. So you need to do a study with 100 million subjects, and so on and so forth. You can never rule out that something is causally related if there is biological plausibility. You cannot rule it out. And this is called the beta error. And this is why you can never say a vaccine is safe. What you usually say is a vaccine has an excellent safety profile. And the package inserts lists the safety profile. Everything that happens after vaccination with some frequency or some seriousness is simply listed there. And the concept is you do a risk-benefit analysis. If all adverse events were in fact side effects, how does that relate to the disease complications? And we'll show you a little bit of that in this meeting as well, and Rabi will embark on this. So this is the basic concept, adverse event versus side effect. And what you also need to remember is risk-benefit assessment. Now, imagine, as an example, hazelnut chocolate was a vaccine, and you would need a package insert. So the package insert would read, after eating this chocolate, the following adverse events were observed: anaphylaxis, diabetes, high blood pressure, stroke, dental caries. This is known side effects of hazelnut chocolate. I don't know a single child with rheumatoid arthritis who had not, before her disease or his disease, had eaten hazelnut chocolate. So you may list as well rheumatoid arthritis, lymphatic leukemia, myocardial infarction. You may list anything here that happens after ingestion of hazelnut chocolate. This is the difference. Causality assessment is the miracle word. Now, the most frequent thing that happens after vaccination is technical errors. Like you miss the injection site or whatever you miss, and this is just one funny example how technical errors are side effects of vaccination. But Rabi, why don't you explain us the types of side effects of vaccines and vaccination?
Sure. So when we talk about side effects, we have what we call local or systemic effects. In the first place, we have reactogenicity, which can be local, which means at the site of injection or the site of administration. For example, pain, swelling, itchiness, or redness that you may feel after being vaccinated on the arm. And then we have the systemic reactogenicity, or the general reactogenicity, which could include symptoms such as fever, muscle pain, or headache. Another type of vaccine effect can be anaphylaxis. So this is a life-threatening allergic reaction, which can present with several symptoms, including difficulty breathing, low blood pressure, feeling lightheaded, and a really fast heartbeat. And it can happen between 5 minutes to 30 minutes after injection. And in 90% of all the cases, it occurs in less than 4 hours. So anaphylaxis, again, would fall under the category of generalized reactogenicity that we just described. We also have, as Joe mentioned earlier, vaccine technical errors, which can be described as immunization, which can also be described as immunization error-related reactions. So one example of this is when a vaccine is administered in an incorrect injection site. For example, if you inject too low in the upper arm, you could cause ulnar nerve damage. So this is the nerve that controls movement of the fingers and sensitivity. You could cause damage to that nerve. But on the other hand, if you inject too high in the arm, you can cause shoulder damage if the vaccine enters the synovial tissues in your arm. So this is these are technical errors that are related to vaccination. So we also have vaccine-specific side effects. These effects are caused by components in the vaccine. Each vaccine may contain allergens that may induce these reactions. For example, stabilizers like gelatin or antibiotics like neomycin and preservatives like thimerosal. I think also a really good mention that's worthy here is vaccine anxiety-related reactions. And I think Joe mentioned this as well. These kind of reactions come from anxiety about immunization. And the most common side effect is fainting with a time to onset of less than 1 hour after vaccination. Actually, it happens within 5 minutes during or after vaccination. And this kind of reaction, fainting, is most commonly seen in mass vaccination campaigns, especially in the preteen and teenage group.
Very good. And here we have listed some disease complications versus side effects, the risk-benefit analysis. How do you interpret this, Rapi?
So this is just an overview of best benefit risk assessment to determine whether the benefits, meaning the illness and deaths that are prevented, the benefits of vaccination outweigh the risks, some of which we have just discussed. So for example, tuberculosis associated with complications like developing disseminated TB and definitely death in 100% of infected individuals, without any treatment or vaccination. Whereas the vaccination BCG, the vaccine BCG that prevents TB is associated with an adverse reaction of 1 in every 5,000 people. So it's clear to see from this that the benefits of vaccination against TB far outweigh the risks.
Mm-hmm. And I think we don't go into the details here, but we have this on our show notes, which you can download, and all references are on the notes page. You will find it there later on as well. I want to come up with another type of side effects of vaccines, and that is vaccine scares. Diseases not caused by vaccines are from the past. Encephalopathy after whole cell pertussis vaccination. Multiple sclerosis after hepatitis B. Only in France, I guess, Rapi, this is considered a side effect of hepatitis B vaccination. Nowhere else in the world, and all the evidence speaks against hepatitis B as a cause of multiple sclerosis. Encephalitis post-MMR, Crohn's disease after MMR, autism after MMR. You see, this is nicely invalidated by Paul Offit in his books and different types of writings. Read it if you have any time. It is really worth doing. This is myths from the past, vaccine scares that have no scientific basis. This is all wrong. And I guess I have one nice example here. In the 1990s, we developed Influenza Hexa, the 6-valent pediatric DTaP vaccine, and all children after 3 primary doses in the first year of life spoke German. Speaking German was a side effect of Influenza Hexa, right? Everybody spoke it, right? And the reason is certainly nobody else outside Germany received the vaccine at that time. Another nice example is there is a statistically significant correlation between hepatitis A vaccination and pregnancy. The likelihood that a female in childbearing age gets pregnant after hepatitis A vaccination is significantly higher than after not being hepatitis A vaccination. Why is this? Very simple. You get hepatitis A vaccination after graduation, after you married, after whatever type of special event, and then you go on a world tour, or you go to a country where there's hepatitis A, Latin America, Asia, wherever you're going, you return and you find out you're pregnant, and then you are asking the licensing agency or the pharmacovigilance department, does this vaccine cause harm to my baby? And the answer is certainly no. There is no reason to believe that hepatitis A vaccination could cause pregnancy, but there is a statistically significant correlation between the two. I just want to explain that it's very difficult. Coincidence and causality, these are the two terms that I want to mention here. And I guess with this, we go now to death after COVID vaccine.
Yep. So very recently, the South African Health Products Regulator reported the first death in South Africa tied to a COVID-19 vaccine. So this person presented with a neurological order known as Guillain-Barré syndrome. Very soon after vaccination, they developed more complications and the condition deteriorated, after which they were ventilated and later died. After causality assessment was conducted, it was concluded that this death was linked to the vaccination. So more than 9 million people were vaccinated in South Africa with this vaccine, and this was the first causally linked case of GBS. The message was really clear from the South African Health Products Regulator, and this is that the benefits of the vaccination outweigh the risks of developing severe COVID due to hospitalization and hospitalization due to COVID.
If I remember the numbers correct, and correct me if I'm wrong, like 1% of COVID subjects, COVID patients die. 1% of 9 million would be 90,000, right? So, one death and 90,000 prevented. This is the type of risk-benefit analysis that you need to do to see the benefit of vaccination. Melvin, there is more side effects on COVID-19 vaccines, and we have listed them here.
Yes, this is a busy slide, and I will not explain all the numbers, but just to remind everyone again that all medicines, drugs, and vaccines can cause adverse reactions in some people. And these adverse reactions can range from headaches and upset stomach to some serious reactions, such as what you read here, from thrombocytopenia syndrome to myocarditis and even death, as you have seen in the previous slide, that it happened. It's the first case in 9 million vaccine doses given. And the message here is the phrase that has been mentioned several times now, benefit risk, right? Benefit risk assessment. So if you compare the cases of these adverse events linked to the vaccines and those linked to COVID itself, the frequency from COVID is always higher. And if we look at long COVID, for example, it is challenging because firstly, the definition of long COVID was only harmonized recently, but we are seeing that those who have been vaccinated are much less likely to report long COVID. So we move to the next slide and discuss myocarditis in more detail. So myocarditis is basically inflammation of the heart muscle. There's another condition called pericarditis, which is also inflammation, but it's inflammation of the outer lining of the heart. Myocarditis is rare, but when it occurs, it is most commonly caused by an infection in the body. Infection from viruses. For example, the common cold can cause myocarditis, influenza can cause myocarditis, or COVID-19 can cause myocarditis, or even bacteria and parasites can also lead to myocardial inflammation. Both myocarditis and pericarditis have the following symptoms. They have chest pain, shortness of breath, feeling of having a fast beating, fluttering, or pounding heart. And I want to emphasize again that COVID-19 itself can cause myocarditis. And you will see on the next slide some of the proposed mechanism of how COVID-19 can cause myocarditis. So here you will see that the latest research is showing that myocarditis, of course, is rare. and they are no more likely to be triggered by a COVID vaccine than any other vaccine. And also that these cases of myocarditis following vaccination have usually been mild, and those affected have usually felt better with the simple treatments or rest. And in most cases, these myocarditis cases, the heart function returned to normal after rest. And then on the next slide, here you will just see that even in the highest risk group, which is the 18 to 29 years old males, there were just 29 cases of suspected myocarditis or pericarditis for every million second doses of the Pfizer vaccine given in the United Kingdom. And this was up until the 30th of March this year. The risk is even lower following a booster. For Moderna, there were 70 cases of suspected myocarditis or pericarditis for every million second doses given in the UK in this high risk age group, 18 to 29 years old. And the same risk for the booster was also even lower. And in other age groups, the risk is much lower as compared to this high risk group. So again, the summary is myocarditis happens with COVID itself, and it also happens, but rarer post-COVID vaccination and even rarer after boosters. So again, looking at the benefit and the risk, the logical choice is really to get the vaccine.
Thank you, Melvin. Very interesting. I remember from the early days of COVID in a study from a German university hospital that a substantial fraction of hospitalized COVID patients did have myocarditis. I remember the number 40%. Is that possible? If you look hard, you will find it.
Yes, that's one. And also, I remember the study in Israel after. That was, I think, in 2021, when they looked at the Israeli army members, right, armies who were given the vaccine, and they said that some of them had myocarditis. But what they did not say is that those people after vaccination went back to training and doing a lot of strenuous activities.
Yeah.
And so it's not unexpected to see them have these reactions when after vaccination they go back to very high intensity training, right?
Great, thank you very much. And another side effect of COVID vaccines, thrombosis with thrombocytopenia syndrome. Funny name, Rafi.
Yeah, so for short, we just call it TTS. And it's a very rare and specific syndrome rather. So thrombosis is the formation of a blood clot, which prevents blood flowing normally through the body. While thrombocytopenia, on the other hand, is a condition where there aren't enough platelets in the blood. So platelets actually help the blood to clump or to clot, which stops you from bleeding excessively in a case, for example, where you cut yourself. So because your blood can form clots, low platelets can lead to bleeding problems. And these conditions can cause inflammation, coagulopathy, and in the blood, when the blood's ability to form clots is impaired. So I really like this illustration. It's so straightforward. On the left, you see the condition of platelets, So these are the little blue circles or ovals, and then the endothelial cells in red. And in the absence of a disease or any stresses in a person's life, platelets and endothelial cells normally do not directly interact. In the middle, you see some activated platelets. So this can be caused by conditions such as aging, obesity, diabetes, and prior history of blood clots. So these conditions can actually cause inflammation and coagulopathy, the bleeding disorder which we just described, in which the blood's ability to form clots is impaired. And finally, on the right, we see the interaction of platelets and endothelial cells, as well as formation of thrombus and emboli. So COVID-19, through either direct actions on platelets and the endothelium, or indirect effects through inflammation and coagulopathy, can lead to increased thrombus or clot formation and to emboli and hemorrhage.
So emboli develop from a thrombus and they are spread through the vessels to other organs like the brain or wherever, and then you have disease of this organ, right?
Yeah, correct. That's right.
Okay, here we go on.
Yeah, so TTS, or thrombosis with thrombocytopenia syndrome, was reported after vaccination with the AZ vaccine. So in countries with ongoing COVID-19 transmission, the benefit of vaccination in protecting against COVID-19 far outweighs the risks. COVID-19 itself poses a higher risk of blood clots in the brain than that of COVID-19 vaccines. So it's really advisable to get vaccinated. And on the right, you'll notice also the treatment options that are available for TTS, including aspirin, heparin, statins, amongst others.
So there is treatment and yeah.
So there's treatment available for the rare cases in which TTS occurs.
And again, to summarize, for both myocarditis and TTS, the risk is much lower than the benefits. I mean, the risk-benefit ratio is very positive for vaccination, right? That is the story that we explain. Now we come to another type of side effect, which are no side effect, but myths. And Melvin, you picked one of the important ones, right? This is really out there and people still believe it.
Yes, so this actually started early on in the pandemic, even before the vaccines became available. And there was a false report showing that one of the proteins that you can find in the placenta actually looks like the protein, the spike protein, which actually it does not look the same. But, you know, when you do all these pseudoscientific false information and just put some references, for example, people tend to believe that, and this goes viral, right? And this is also now tied to the term sterilizing immunity, which goes back to our discussion about good medical language, right? For people who are not medically or trained clinically or are not healthcare workers, when they hear the term sterilized, they think this is sterilized that is not able to produce or not able to become pregnant. And when they hear the word sterilizing immunity talked about by people, they think that these two are related. But basically, no, because there is no plausible reason or medical or scientific mechanism to explain how COVID vaccines can interact with a woman's reproductive organ or interact with an egg that's been released or fertilized. And of course, studies are ongoing, but we know that there is no data to show that COVID-19 vaccines can cause infertility.
So basically, sterilizing immunity means that the organism no longer can colonize your throat in this case, right? It has nothing to do with the reproduction options, right? So you still are fertile, and this only relates to the presence or absence of the organism in your throat after vaccination. So the whole thing is so stupid, I cannot believe it. Melvin, what does this mean?
So this is showing us a 101-year-old lady that became infertile after COVID-19 vaccination.
Yeah, I guess it's a joke, right? From a German comical journal that I like very much. And they picked the story up. And I think if you're 101 years old, you don't want to get pregnant and you cannot get pregnant, right? So,
I mean, and this is for people who can actually reach 101 years of age.
Very nice. Another thing I worry about is that trolls and single politicians and so-called scientists use vaccine misinformation to stop political discourse. And this is a nice paper listed down here in our reference section. Misinformation in this study spanned personal dangers, liberty violations, and conspiracies. Tweets about vaccines often referenced side effects or symptoms. Engagement with misinformation was low, some intended to correct misinformation. Users should be aware of tweets that are characteristic of misinformation. And in Germany, we have one politician who was a member of parliament. For any vaccine that is new and that comes up, he has a reason why to not use it. So this is out there, and this is out there in all types of countries. They tell you about infertility, they tell you about whatever, and it is all stupid. And one of the items that they always come up with is zombification, and actually Rapi will tell you about that later. But Melvin, you have more on trolls.
Yes, so here we reference a study showing that bots disseminated anti-vaccine messages. So when you say bot, it is short for robot, and also called an internet bot, and it is a computer program that operates as an agent for a user. And several accounts masquerading as legitimate users create false information, promote confusion, and in the end also erode public consensus and public trust on vaccination. And the studies show that Russian trolls played both sides. They tweet pro-vaccine and anti-vaccine content, and because of that, they increase the political charge and the chaos surrounding the discussion. So it's always really advisable to be careful of where you get your information from. And I maybe in a future Global Health Cast we discuss about how to do that, but just quickly, always check the source of your information, check the author, check other sources. Are other people or other news media reporting on the story that you've read? And verify if it is reported by websites or social media channels like the WHO, CDC, or European CDC, or our Global Health Press.
Yeah, and this is another source of misinformation, or another piece of misinformation, Rapi. Any explanation for that?
Yeah, it's really astonishing that while the world battles between the optimistic news of vaccines rolling out globally and the horror of new strains of the coronavirus being discovered, some people on social media have come out with a ploy to spread panic in these sensitive times. So according to the claim made by some social media users using edited pictures, injecting the COVID-19 vaccine will turn humans into zombies. So in some cases, you find that these artists or authors of this misinformation do so purely for satirical reasons. It's just a joke. And this joke is usually missed by a lot of people, and these claims go viral really, really quickly.
Yeah, that is something I
yeah.
can't believe in the 21st century, right? This is unbelievable.
Yeah, and a joke can turn very quickly into fake news on social media, and the consequences of this kind of fake news are really far-reaching, especially with the pseudo-scientific news against vaccinations doing the rounds globally.
Yeah.
COVID-19 vaccines will not turn anybody into a zombie, I can assure you. And, this is our cartoon of the week. It shows that, this zombification agenda has been going on, or, has been reported from as early as the 1700s. It's really an old story. It's never happened, and it's not going to happen.
Yeah, and actually that was in response to the smallpox vaccination at the time. And the cartoon is supposed to show that people change their bodies, and so it's nothing new. And it's just funny that it pops up again. I mean, unbelievable. Yeah. Well, what we talked about today was COVID-10 update. Numbers are, let's say, roughly the same, or going down. Monkeypox data are going up. Adverse event was the big topic today, and you need to distinguish between adverse event and side effects. The difference is side effects, a causal relation to vaccination was shown. Package inserts don't list only side effects, they list adverse events. So many things are listed there that may not be causally related to vaccination. And because of that, in the end, you have to do a risk-benefit analysis. And if you do that, and we've shown you the data for old vaccines and also for COVID vaccines, risk-benefit analysis hugely favor vaccination. If you read new information on side effects of vaccination, do a plausibility check. And particularly if you have your data from social media. Use trusted sources, WHO, the American CDC, globalhealthpress.org, our website, or your local public health office. If you have any suggestions, any questions to side effects or any other infectious diseases and vaccines topic, please write us to globalhealthcast@globalhealthpress.com. And I guess this is our last slide for today. You should not believe everything you're thinking, which was first said by Heinz Erhardt, a German comedian who died in 1979. So this is very important to remember. Whatever you see for the first time, make sure that it is the truth, or whatever you hear from, particularly when you find it on social media. This was our Global Healthcast on August 9th, 2022. Please like, share, and leave your comments below. Thank you for joining us today, and a particularly great big thank you to Rapi. Thanks for joining us. It was a pleasure to have you.
Oh, thank you, guys. Thank you for having me.
Yeah, I am Joe Schmidt.
And I'm Melvin Sanicas. And
bye-bye.
Bye-bye.
Thank you, everyone. Have a nice day.